On behalf of everyone here at Phoenix Children's Hospital at the Center for Cancer and Blood Disorders, we want to offer this video to you as a resource to help navigate your cancer journey. My name is Kaylee Nelson and I am a pediatric oncology social worker. And you may be wondering why you have a social worker, but I promise we're here to help.
And my name is Amanda and I'm a nurse clinician at the Center for Cancer and Blood Disorders. There are many nurse clinicians and we will help take care of your child in the clinic, as in giving chemotherapy. We will answer your calls when you have questions when you're at home, and we'll help guide through the insurance and pharmacy issues you may have.
I know cancer is scary, and it's okay to be scared. It's okay to be confused, and part of the reason we're doing this video is to help answer some of the questions that you still may have. You probably received a manual or a notebook that we gave you. Don't worry if that's totally overwhelming. We're gonna go through that, and part of the video is we're gonna go through that information as well. But bottom line, if you have questions, ask. And if you're at home, give us a call.
Okay, so it's time to go home. A few things need to happen first. First, we want you to go ahead and get all of your prescriptions filled. You can either do that at your local pharmacy or come to the PCH retail pharmacy down on the first floor. We want you to bring those prescriptions up to be looked at by the nurse or the doctor before you go home. Secondly, we want you to have a follow-up appointment. Make sure you know when to come to the clinic. And then last, we want you to make sure you know how to take care of your child at home. Have all your questions answered, but please always remember that when you get home, you can always call the clinic for any questions you have.
So we're hoping this video answers a lot of the what if questions. What if my child has a fever in the middle of the night? What if someone says something to them at school? What if they start to lose their hair? Give us a call, ask the questions. We're here to help.
Throughout this video, we've discussed a lot about the clinic, and you're probably wondering what the clinic really is. Really, the clinic is almost like a doctor's office. It's an outpatient place where you will bring your child, we'll give chemotherapy, we can do blood transfusions, labs will be drawn, ports will be accessed. We have 3 different locations. One's at the main campus, there's an East Valley location, and one in the Southwest Valley. Those addresses are in your notebook, and if you have any questions or concerns, please feel free to ask us.
Refer to the notebook, watch the video, and bottom line, if you have a question, ask. So as you start to head home, you may wonder why we've asked so many questions, but it's really great for you to be honest with us so we can help you guys. If we know what's going on at home, we can help you guys when you come into the clinic, and even throughout treatment. If something's going on at home, we want to know about it, and it's just so we can help you.
When your child was diagnosed with cancer, it actually affects the whole entire family. We ask a lot of questions to get to know you guys, and that is just to serve you the best.
There are many different ways that your social worker can help you. One of them is by offering counseling. We can sit with your family and talk through certain issues that you or your family may have. If it's more intense, we can set you up with a counselor through your insurance. We can also help arrange transportation, and if you guys live outside Maricopa, we can help identify lodging, which may include the Ronald McDonald House. We also help with school issues. That may be the first thing that you think about is, will my child be able to go to school? We can work with your school directly to help identify if your child needs a 504 plan, an IEP plan, or even homebound services.
We know the cancer diagnosis is not fun, but our goal at Phoenix Children's Hospital is for your family still to have enjoyable time together. Our social workers, like Kaylee, are able to offer you activities and organizations where you still can have fun as a family. Lastly, nurses like myself are able to answer your questions, help with medication administration, or just be an ear to listen to if you have questions or concerns. Please always call us.
So you guys are heading home, and you may wonder what that looks like. We want things to be as normal as possible, and if your child had consequences before, you should follow through with them now. We want you to be consistent and have part of that normal life back. We also know that you may want to clean your house top to bottom, but whatever you guys did before is what you should do now.
Germs naturally occur everywhere. They're on our skin, they're in our mouth. The most important thing is to try to stay clean. Daily showers, doing your mouth care 3 times a day, and staying away from sick people. And the most important thing we can impress is hand wash, hand wash, hand wash.
So when you're told that your child has cancer, a lot of questions pop up. Can they have friends over? Can they play sports? Can they have pets? We're going to go over these questions in this next part.
As you can imagine, there's many different cancers, so with these questions come many different answers. One of the most common questions we're asked is, am I allowed to still have my pet? I have a dog, I have a cat, I have an iguana. What do I do? In general, we just want you to ask your medical team. Some pets are allowed, some aren't. No matter what, we don't want your child to be in charge of picking up the poop of the animal. No dog poop, no litter box scooping. They still can do other chores, but not those. Next comes pools and jacuzzis. In general, for this video purpose, we're just gonna say no. You can always ask your medical team what they feel is appropriate, but for right now, we'll just say no.
We want your kids to be active. We want them to go outside and play. We ask that if they do play sports, that if they have a portacath, that they don't play a contact sport. Specifically, just ask your team and they'll have that conversation with you of what they can and can't do when it comes to outside activities.
Throughout this video, we've encouraged your child to stay as active as possible. The exceptions to that are on windy days, if it's not possible to stay indoors, please have your child wear a mask when outside. Another is on really hot days, stay inside on the hottest part of the days and wear a hat to protect their head, stay hydrated, and of course use sunscreen. In the clinic, we'll talk a lot about immunizations. One of the most important we feel is the flu shot. We encourage the patient and the family to both get them in the shot form of it only. In regards to other immunizations, please talk to your team before getting any immunizations for your child. Your child will have new norms. One of the new norms will be mouth care. This consists of two different products. The first product is Biotene. It's a clear solution. They'll swish and spit this product out. That is followed by Nystatin or the Troche. These are either a swish and swallow or a dissolve and swallow. Both of these products are done 3 times a day, and the important thing to remember is there's no eating or drinking for 20 minutes after this. The next new norm will be Bactrim. It's an antibiotic that's given on the weekends. This is to help to prevent a certain kind of pneumonia that the children may get. If your child is allergic to Bactrim, please let us know, as there's always a substitute. There are many different cancers, which mean many different medicines. We just want you to make sure you have all your prescriptions filled before you're sent home from the hospital, and make sure you have refills on the medications and you get them refilled before you run out.
Here's a few tips on taking medications. If your nurse or doctor said that you can crush a pill, you can go ahead and put it in a spoon. You can cover it with yogurt, chocolate syrup, or even take some juice concentrate, and that way it hides the flavor a little bit. One of the things too is we want to give the child an opportunity to make a choice. They don't get a choice in whether they can take the meds or not, but they can choose whether they want mom to give them or dad. Do they want to take them in the living room or in the kitchen? We want to have them have that opportunity, and also be consistent. The best way you can help them is to make this a routine.
When your child was diagnosed with cancer, you were given a lot of prescriptions and received a lot of medications. All of these medications have different side effects, so please call the clinic with any questions or concerns. One of the common questions we receive is, what do I do if my child vomits after I give the medication? Our answer is to go ahead and re-give the medication if the child had vomited within 30 minutes of taking that medicine. As we discussed, there are side effects with chemotherapy. Some of those side effects can be low blood counts, mouth sores, nausea and vomiting, and even constipation. We have medications to help with some of these side effects. One of the medications is Zofran. It's a medicine to help with nausea and vomiting. If your child says that they don't feel well, they don't really feel like eating, you can always give Zofran if it's time to see if that will help them. It's better to give it early than wait until they're vomiting. The next is for mouth sores. The mouth care we prescribe doesn't prevent the mouth sores, but helps them from getting infected. If your child does get mouth sores, make sure that they're staying hydrated and that you have pain medicine to give them if they need it. Offer soft foods, non-spicy foods are best. Then the next is constipation. We ask regularly when's the last time your child had a bowel movement. We want it to be an open conversation for you and your child at home. There's medicines to prevent constipation or even help treat it. There's Colace, Senokot, Miralax. Ask your doctor if you don't have those medications at home, and just remember it's best to help prevent the constipation before it gets too bad. The next is low blood counts. Sometimes when the hemoglobin, the red cells, or the platelets that help us stop bleeding get too low, your child will need a transfusion. This can either happen in the hospital or it happens out in the clinic. If you have any questions regarding this, please just ask us.
So it's inevitable that your child will lose their hair at some point through this process. We want to give them an opportunity to have some control in that. They don't get to control whether or not they lose their hair, but we want to give them some control in how they lose it. Maybe they want to have a fun haircut, maybe change their color. Just have fun with it. And if you're okay with it, then they'll be okay with it. We've had parents who've thrown a party. They may have shaved their heads with them. You know, there's no wrong way to do it, but just making sure that you're doing it as a family. So when you guys were on the 7th floor, we know you had nurses available at any time. And now you guys are home and it's just you. We want you to be comfortable, and we know that takes time. And it'll take time to get that routine down. But until you do, we're on your side and we're your team. So bring your meds into clinic, and don't forget you can always call us.
So there are some really important things that we want you to call for if it ever happens to your child. Our clinic phone number is 602-933-0920, and you can call that anytime and someone will answer your call. One of the most important things to call for is if your child ever has a fever. Our fever guidelines are a temperature of 100.4, 2 times at least an hour apart. Once again, that's 100.4, 2 times at least an hour apart. Also, if your child's temperature is ever 101.0 or greater, please give us a call immediately. I don't want you to give Tylenol to help reduce that fever. This is an emergency and we need a call. Also, if your child is bleeding, we want you to hold pressure on their nose for about 10 to 15 minutes to try to get the nosebleed to stop. If it doesn't stop, go ahead and give us a call. If your child is having some nausea and vomiting, try your home medications and see if you can help this. If not, give us a call. And really, we can't reiterate enough, just give us a call. If you have any questions or concerns, or you're just not sure what's going on, please call the clinic, 602-933-0920.
So now you're ready to head into the clinic. You probably received a box of Glad Press and Seal and a prescription for Emla Cream, which we also call Magic Cream. We call it Magic Cream because it numbs the skin. So when your child is ready to come into the clinic and get their needle put in their port, we ask that you put a blob of the Emla Cream around their port site and then cover it up with a square piece of the Glad Press and Seal. And then you're all set.
Sometimes before a clinic appointment, your child will have to be NPO, basically meaning they can't eat or drink before the appointment because of a procedure. It's 8 hours for a heavy meal before the appointment, 6 hours for a light meal or formula, 4 hours for breast milk, and 2 hours for clear liquids. If you have any questions on this, please just ask.
Some helpful clinic tips. You want to bring extra clothes to stay warm or a blanket. You can always bring food or something to drink. We do have a nutrition room that you can get snacks at. You also want to bring things to help keep your kid busy. It could be a long day and you want to make sure that they're fully entertained. Also, on your way out, you want to schedule an appointment for your next visit. And don't forget to talk to your kid about the appointment. You don't want to do it 5 days in advance because there may be some anxiety, but you do want to let them know what to expect when they do come into clinic. Here's some helpful hints to help you through your cancer journey. 1, always have an extra bag handy. That way, in case you get admitted and you're not planning on it, you have some things to get you through. Also, if you're interested in meeting another parent or family, ask your social worker and we can help pair you up with another family that has similar diagnosis. Also, you may be wanting to get on the internet and Google your diagnosis. We have the Emily Center, and we also have pre-approved websites that you can go to get more information.
So we know having your child diagnosed with cancer is really hard. Please just take each day at a time and enjoy each day with your child. Also, just to reiterate, if your child does vomit within 30 minutes of taking a medication, go ahead and give another dose. If you have any questions or concerns, as always, please feel free to give us a call.
So we know you've heard a lot of information and you're probably still really overwhelmed. Don't worry, we will continue to walk you through this process. Ask questions, give us a call, we're here to help.